the new guidelines for BPH that came out. And the AUA has guidelines for lots of different disease processes. With BPH, we have different levels, and it's grade A, grade B, grade C. And PAE has been part of the guidelines since 2023, and it had a grade C designation. Well, at this year's AUA, it increased to grade B. Basically, grade B means that there's a lot of evidence suggesting that this is a good treatment option for BPH, although there could be more evidence that could come out which could push the efficacy or the ability of the treatment to treat BPH.
No, absolutely. I think this endorsement from the American Urological Association is going to serve as a big game changer, not just because it supports what we're currently doing, but also this should also give a lot more credence for patients to get this patient covered and paid for. So, I mean, I think the big change is what you just said. It went from being somewhat of a classified as an investigational only to a recommendation. Now, does have some conditions to it, but I think it's definitely a huge move in the step in the right direction. I think it really comes down to a few different things. That there's some studies out there, but I think it really comes down to a couple major studies. One was there's this large, like a single blind study comparing the prostate artery embolization to a sham procedure. They found improvement in the key scores, the IPSS score, showing improvement in voiding and urination. They found also volume reductions as well. And then there's a large series that was produced by Doc down in Miami, Dr. Badia's group. They did about 1,000 of these procedures, kept track of it over a very long period of time. And I think that also serves as, even though it is a single center study, a lot of great information that we can get out of that. I mean, he looked at the procedure from multiple time standpoints, looking at prostate artery embolization initially at 3 months, 6 months, even going out to 4 to 6 years out.